By now, you have heard of the United Healthcare CEO who was murdered. I want to just really discuss the frustrations of our US healthcare system. And today, I want to help you understand the root cause of the frustration and the burnout and the role of healthcare insurance. For example, there was a woman recently who said at the end of her conversation, she was on the phone with an insurance company. At the end of the conversation, she ended it with delay, deny, and depose after dealing with the insurance representative. So this really encapsulates the feeling of many healthcare professionals. When we think about throughput, patients that are currently in the hospital going into nursing homes or their next step, we have to wait for the authorization. Sometimes patients just have to sit in the hospital for another 48 hours so that they can get authorization to go on the next step where we know that they already need it. These delays result in overcrowded units and increased patient to nurse ratios, exacerbating workload and stress.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. Today, I want to talk about a topic that has been in the news for a couple of weeks now. By now, you have heard of the United Healthcare CEO who was murdered. However, the purpose of me talking about this topic today is because I want to just really discuss the frustrations of our US healthcare system. And it's really sad that things have come this far and that it has gotten to a point where our citizens have resorted to murder of CEOs. And I want to be clear, and I've said this in the past, myself, Nurses with Voices, we do not condone what has happened and what has taken place. But I do want to make the connection and the frustration because I think it's important that our community understands how things can get this far from a perspective of a healthcare worker, right? Not just a healthcare worker, a nurse, and someone who is at the core of the community, of the frontline staff in and out of the hospital. And I think it's just important that we understand the healthcare system places immense pressure on nurses. And today, I want to help you understand the root cause of the frustration and the burnout and the role of healthcare insurance. For example, there was a woman recently who said at the end of her conversation, she was on the phone with an insurance company. At the end of the conversation, she ended it with delay, deny, and depose after dealing with the insurance representative. So this really encapsulates the feeling of many healthcare professionals and patients who face endless bureaucracy. And these insurance companies practices such as delaying approvals, denying claims, and creating unnecessary hurdles, they directly affect hospital throughput, which increases patient wait times and length of stays. And these inefficiencies creates a cascade of stress for nurses who must manage frustrated patients, overcrowded units, and reduced resources. These systemic frustrations underscore why addressing burnout is essential and why I'm passionate about sharing strategies. Now, some people may want to call it emotional intelligence. Some people may want to call it depression. Listen, burnout is real and it's something that we can avoid. But I think there also needs to be conversations around it and there needs to be discussion so that we can make the connection as to how these systemic frustrations or these systemic policies really contribute to our healthcare worker demise. It's sad that it takes these type of events and it takes something tragic for people to really understand there's a problem with our healthcare system. There's a problem that is affecting not only our healthcare workers, but it's affecting our community. And what are we doing? So when we talk about how insurance policies significantly impact frontline nurses, and it contributes to increased workloads, administrative burdens, and emotional stress. And all of these are key factors leading to our burnout. Now, let's talk about administrative burdens and delayed patient care. Insurance requirements often necessitate extensive documentation and prior authorization for treatments and for medications. Now, this administrative workload falls directly or heavily on nurses, right? Diverting time away from direct patient care. And I talked a little bit about this in the past about nursing documentation. For instance, I know we talked about turning patients every 2 hours. I've worked places, and I'm just going to be honest with you. I've worked places where patients were actually turned every 2 hours, and I've worked places where it was just documented that they were turned every 2 hours. Now, the moral and the ethics of the caregiver is for them to deal with, right? The point is that the hospital gets paid based off of what is and what is not documented. So the overarching question is, does anyone actually care if the patient is turned, or is it about profit? This is what makes nurses often feel like pawns in a system driven by financial motives rather than patient outcomes, especially when administrators are pressured to meet metrics dictated by insurance companies. And I can personally speak to this and if I'm being completely transparent, I can personally speak to this. And nurse leaders, if you're with me, you are. If you're not, that's fine too. Let's just use our Prescaney scores, for example. We would look at the metrics of our Prescaney scores. Personally, I based my outcomes and I based my teachings and my coaching to my nurses and to my staff based off of Prescaney. I know I'm not the only one who does that, because the organization actually invested in a company that came in and coached all of the leaders to do just that. Why? Because the Center for Medicare and Medicaid Services said if you have a poor survey, you're not going to get reimbursed if your nurses aren't listening carefully, or if the patients are saying that your nurses aren't responding in a timely manner, right? Think about it. A lot of these things are perception. Now, what is a timely manner to you may not be a timely manner to someone else. And I say that because I made a lot of discharge calls. I would call patients and follow up with patients after they were discharged and say, hey, did the nurses respond in a timely manner? For some people, that perception may be, oh, yeah, they were right on time. But for some people, if they really had to go to the bathroom, for some people, that minute could have seemed like 5 minutes or 10 minutes, or could have seemed like 30 minutes, even though the nurse got right in there as soon as she can. So I say all this to say those patient experience surveys really drove hospital reimbursement. So the hospital wasn't reimbursed if they got a poor survey. And again, I'm guilty of this as well. So now the nurses are driven to make sure they're taking patients to the bathroom, which it does place a level of responsibility and accountability into the nurse. However, when the nurse has multiple other tasks and when they don't have the resources to really fulfill it, you do put undue burden on the nurses. And this was something that I started to investigate after I left the inpatient setting. My units did very well, and the patient experience scores were through the roof. We're satisfied because we're seeing the numbers, we're driving in great patient experience, but are our nurses satisfied? So it's something that we have to think about. Now, a survey revealed that 84% of nurses believe that insurance administrative policies delay care. 74% feel that they reduce the quality of care, and 56 report a decline in job satisfaction due to these requirements. Now, this was a survey that was done by Healthcare Brew. Now, let's talk about the impact on hospital throughput and staffing. I touched on this a little bit with my explanation about patient experience, but let's look at how insurance policies can lead to delays in patient admissions and discharges, affecting hospital throughput. Where are my ER nurses? The ER and inpatient nurses, there is this constant battle about throughput. If you ask an ER nurse their opinion, and there have been some studies that will say, you know what, okay, the patient has a bed, the patient is cleared, the patient should be taken right. We'll try to call a report, but guess what? If this isn't a medical surgical patient, this patient is being sent up to the room that has been assigned to this patient. Now, you have inpatient nurses who saying, absolutely not. And yet again, this is something that I experienced as a nurse leader. I can remember practices like this getting put into place. I can remember dealing with this at one hospital, and when I transitioned to a new role, I remember dealing with the same exact thing at another hospital. What happened? It was because of throughput. When you consider throughput, you have nurses who are sending patients up because what happens? They got to get out of the ED. Why? Because those minutes have to be down. And I'm summarizing it and I'm placing this in layman's terms, but they have to get those patients out of the ER at a certain time frame. And what happens? Now that patient has to go to the bed that's assigned on a nursing unit. The nurse may not be ready. So now that patient is sitting in that room and the nurse may or may not even be aware. And what we would hear was, oh, we gave report in the computer. So it was a huge controversial about how this is a safety issue. But guess what? The hospitals are making money. So yet again, another instance where we're putting profits over patients. I hope you guys are staying with me here with what I'm talking about, because I'm really just trying to highlight the frustration of so many nurses and why all of these policies and procedures, though the organization may feel like they're doing what's best for the patient, but are you? Have you really asked yourself, or have you really taken into consideration what your frontline staff are saying? Because when we think about throughput also is for patients that are currently in the hospital going into nursing homes or their next step. Now, when we have to wait for the authorization, sometimes patients just have to sit in the hospital for another 48 hours so that they can get authorization to go on the next step where we know that they already need it. But now guess what? These delays result in overcrowded units and increased patient to nurse ratios, exacerbating workload and stress. When we look at recent research indicates that each additional patient per nurse is associated with 23% increase in the odds of nurse burnout. Now, this is a study that was done by the University of Pennsylvania through their Leonard David Institute. Now, let's talk about moral distress. Moral injury in healthcare highlights the burden when professionals cannot provide the care that they deem necessary due to systemic barriers. And this is why and how it's so important to really start to look at what's happening, because the frustration from patients, it trickles down to nurses. So now you have patients who are frustrated because they can't leave. You have nurses who they actually have to deal with the frustration of patients because they're the middleman. What's the saying? People generally lash out at the person who is closest to them. The nurses have no control over them needing to stay, but what happens is they now get the brunt of the frustration, similar to how the CEO got the brunt of the denial and the proposal. And it's unfortunate. And I hope that I don't sound like I don't have any empathy for the family or for the CEO who lost his life. But I do want to point out that nurses deal with this all the time. Nurses are the subject of workplace violence from patients. And I want to point out how Texas has a law. So there's a Texas law allowing nurses to now press charges against patients who assault them. This represents a step forward in addressing workplace violence, which is a critical factor contributing to healthcare worker burnout. However, this legislation also highlights significant challenges and risks for nurses, particularly in relation to patient frustration and unintended consequences of filing complaints. And let me make the connection for you. When we talk about burnout from patient threats and frustrations, escalating patient frustrations, patients frustrated by long wait times, denied insurance coverage, or systemic delays often redirect their anger toward frontline nurses. Now, these verbal or physical threats compounded by chronic understaffing and emotional exhaustion lead to higher levels of stress and burnout among help nurses and healthcare professionals. Now studies show that nurses are at greater risk for workplace violence than most other professionals. Why is that? Why are our nurses not protected? And why is Texas the only state that has these type of laws? Assaults from patients and their families are not only physically harmful, but they're also emotionally draining, eroding nurses' sense of safety and their well-being. Now, the Texas bill acknowledges this reality by giving nurses a legal avenue to press charges, and, it also empowers them to stand against violence. It's a double edged sword, right? There's a double edged sword of filing complaints. So while the ability to press charges is positive, it's a positive development. The process comes with significant drawbacks. And this is what I mean. You have exposure of personal information. Filing a complaint means that the nurse's personal information, such as their names, potentially their address, becomes a part of public record. And now this is accessible to the attacker. Huge safety concerns around that. So this exposure can lead to additional threats and retaliation, harassment. It's further exacerbating the emotional toll on nurses and undermining the sense of security. The combination of workplace violence, administrative burdens, and systemic frustrations like insurance delays, it creates an overwhelming environment for nurses. And you have to consider moral and ethical dilemmas. So nurses often feel torn between their duty to care for patients and the need to protect themselves. This moral distress compounds their sense of burnout. We have to address these issues. And to address these intertwined issues, we have to, one, increase security measures. We have to protect our nurses by ensuring their personal information remains confidential when filing charges. We have to provide emotional support. We have to offer counseling, peer support groups, and mental health resources to nurses who experience workplace violence. We have to advocate for systemic change. We have to partner with lawmakers to refine legislation so that we can ensure that it's not only protects nurses' rights, but it's also their safety. And we have to acknowledge it. And by acknowledging the complex interplay between patient frustration, workplace violence, and burnout, healthcare leaders can take actionable steps to create safer, more supportive environments for nurses. If I have opportunities to partner with healthcare organizations. And this is what my company does, DL James Consulting. We not only mentor nurses, we also consult with organizations so that you can retain your healthcare worker staff. Someone who has over 22 years of healthcare worker experience, I can tell you firsthand, we have nurses funneling through the system who are coming out of nursing school, and right now they are averaging 3 to 5 years, and they themselves are telling you that they are burned out and they're ready to do something else. How do we mitigate these challenges? Focus on streamlining administrative processes, right? Reducing unnecessary paperwork, improving our electronic health records, advocating for policy changes, engaging in health policy making to address systemic issues. Understanding factors that affect nurses' participation in policy making can offer insights into strategies to strengthen their role in health policy. Because nurses are the ones who are at the front line. They're the ones who are being made to put these policies into play. So we have to provide them with adequate staffing, mental health resources, professional development opportunities. These are all of the things that can support our nurses in their roles. And by addressing these factors, organizations can create a more supportive environment for their nurses, ultimately improving patient care and reducing their burnout, improving nurse retention. So these issues are deeply intertwined. And as nurses, we often bear the weight of the system designed to profit rather than care. But listen, there's a way forward. If you're a nurse listening to this and you're ready to transform your frustration into breakthroughs, burnout into prosperity, I actually put together a free webinar that's happening this coming Thursday, and I'll put all of the details in the show notes. And the webinar is called The Secrets to Transform Your Burnout into Breakthrough. And it's about prosperity. It's about being able to prosper. So organizations really have to decide, how are we going to help our nurses prosper? And then nurses also have to advocate for themselves and start to decide, how am I going to prosper on my own? And part of that is about seeking mentorship and understand when it's time for you to move from burnout to breakthrough. I hope that all of the listeners who are listening to this information, I hope that this was helpful. I hope that it was insightful, because we really need to understand where this frustration is coming from and how it's affecting our nurses and our healthcare professionals. And that's what this episode was about. It's about giving you some education and also giving you empowerment so that you understand how our healthcare workers are affected. So it's not just the United CEO who's affected and his family, though I do send my condolences. However, it's our nurses, our healthcare system. There needs to be a revision, and we need to start by listening to our nurses who are at the bedside. We really need to start by listening to our healthcare professionals, our nurse leaders, and taking their insight and partnering with consulting firms like mine. And listen, if I came across passionate during this episode, it's because I am passionate about this. And I am passionate about not only helping the nurses, about helping the organizations to achieve retention, to achieve that nurturing effect that the nurses are actually looking for. I welcome your feedback. Please comment, subscribe to the channel. I welcome your feedback on what you have to say and what your perception is about what's happening in healthcare right now. So until next time, make sure that you stay inspired, stay educated, and stay empowered.